you give me any treatment options for ADHD other than medications?
Yeah, sure. There's a whole range of things. So, the first thing you need to understand is that ADHD is a neurodevelopmental disorder. So, you have to think longitudinal, you have to think longish term, you have to think the whole film here and not a scene or two from the film of your life, right? So, with that in mind, you normally see that ADHD tendencies they do run in families. So say either one or both of your parents, and it's there in the family tree. The kind of brilliance is there, and the kind of ADHD tendencies is there, right? So we see that clinically all the time. And so now, with that in mind, one needs to understand that one has to modulate the hardware deficit before you do any kind of software upgrade, right?
Yeah.
So you get that point,
Yes.
what I'm saying? So now, how does one sort of modulate the hardware sort of wonkiness? It has to be a molecule or two, right? A medicine or two, because it's a kind of tangible biological thing, right? So now, if you look at the evidence base, so in medical science, if you see, if first task for any doctor or any client is to get absolute diagnostic clarity, and once that's established, then you look at the evidence base for what works, what doesn't, and what the science has to say. And if you look at any kind of guidelines from across the world, the UK NICE guidelines, or the APA, etc., obviously for ADHD and particularly adult ADHD, first line is a stimulant medication. I mean, there's so much robust data that it works. 80% sort of improvement in the dysfunctional tendencies. So, I always say that medicine is the essential first step. And then there's a kind of plethora of non-pharmacological interventions that are needed.
Okay.
So that would include your, ADHD coaching, individual CBT-based sort of therapy for optimizing your functioning, group-based sort of interventions and more, right? So all that, there is no evidence base for effectiveness unless they are coupled with appropriate and judicious use of the right medication. In combination, it's gold standard.